Hello there, my name is Sunny and I'm the Educational Fellow for the Leicester Royal Infirmary Emergency Department. This video is a cross-specialty paediatric trauma video designed to show the processes involved in receiving a paediatric trauma call to the emergency room. We have recorded the patient's journey from the pre-hospital call from paramedics through to patient arrival, stabilisation and safe transfer to the CT scanner. This video has a few key objectives we would like everyone to look out for. The first objective: wearing AGP level PPE has a large impact on effective communication. Look out for the use of communication aids such as whiteboards and hand gestures that help with this, particularly when communicating with parents and carers. The second objective: how to clearly allocate roles within a large team. In our department, we have trauma stickers that we use to identify staff members. These are used for both adult and paediatric trauma calls. The third objective: how to access the emergency room safely. Many staff will be new to the department or this hospital. This video captures the journey of specialties coming to the emergency department and some updated COVID-19 donning and doffing procedures. We begin with a pre-alert call to our emergency room, answered by the nurse coordinator. She's informed of a 12-year-old male who has fallen off his bike at high speed about an hour ago. The ambulance crew are concerned that the patient has sustained chest wall and abdominal injuries. The patient is unstable and is approximately 5 minutes away from the hospital. The nurse coordinator relays this information to the consultant and registrar in the emergency room. She then puts out a paediatric trauma call by calling our emergency switchboard number 2222. For ease of use, we have used the phone on speakerphone. The Paediatric Intensive Care Unit registrar is alerted by his bleep. He immediately contacts his consultant to ask for additional support. Meanwhile, in the emergency room, the consultant has taken on the role of team leader. All team members are using stickers to help identify each other and their respective roles. The adult trauma booklet is used for both adult and paediatric trauma calls for documentation. The team leader is using a mini whiteboard to allocate tasks to his colleagues. The registrar is summarising key points from the pre-alert sheet on the large whiteboard for all team members to refer to. He is also writing a wet flag calculation for emergency drugs and interventions. The nursing staff are fetching all relevant equipment and paperwork prior to patient arrival. At this point in the journey, the paediatric intensive care consultant is in the donning and doffing porter cabin located outside the emergency room. In the porter cabin, he is greeted by a healthcare assistant who helps him safely don. He then makes his way to the emergency room, approaches the team leader and uses a mini whiteboard to introduce himself. He is then provided with a trauma sticker which he places on his upper arm for clear identification. The sticker is placed here to prevent it being covered by an apron that will be worn later. The same process occurs with other specialties inclusive of anaesthetics and paediatric surgery. Now that all members of the trauma team are present, the trauma team leader refers to the summary on the large whiteboard to ensure that everyone is aware of the pre-alert information. He then confirms roles and relevant tasks with the use of his mini whiteboard and hand gestures to help with communication whilst wearing a respirator. Team members are putting on aprons and gloves in preparation for the patient's arrival. These are located in trolleys situated outside the bay. Once the patient arrives, the team members begin their assessment and relevant tasks. The emergency medicine registrar uses a mini whiteboard to communicate clinical findings to the team leader. He closes the communication loop with a thumbs up to indicate that he has acknowledged this. Approximately 15 minutes later, the patient has been stabilised and is ready for transfer to the CT scanner. The team leader coordinates this and ensures that the radiographers are ready for patient arrival and communicates this to the rest of the team. The emergency medicine registrar uses the mini whiteboard to effectively communicate with mum to ensure that she is aware of the next steps. The team members refer to the ER transfer checklist to check that all safety measures have been addressed prior to departure from the emergency room. We hope that this video has successfully summarised the processes involved in receiving a paediatric trauma call to the emergency room. For any further information, please feel free to contact the Emergency Department Education team. We look forward to working with you all soon.